Guess I need to upload this message as well. Okay, so it doesn't look like anybody else is logged on, so I don't want to belittle the time, and I want to respect everybody's time and what they got to do. And then if it goes a little longer, then of course we can just hit the relog back in button and then go back in and catch up or finish off whatever we are conversating about. Okay. All right. So we'll dive right into it. Your homework assignment was on pharmacology, right? Some of the drugs that you all are or will be using, correct?
Right.
Okay.
Yes. Yes.
All right. So let's talk about
Hey,
those.
Miss Al. Hey, Miss Davis. Good morning, y'all.
Good morning. Good morning.
Okay.
All right. So let's talk about some of these drugs here. Okay. So you have on your document, do you have your documents in front of you?
Yes. Well, not right now, but I have it on my phone.
Okay.
You're talking about the homework assignment, right?
Correct.
Yes.
Okay.
Yes.
All
I
right.
have the document here as well. Yes.
All right, good. All right, so you know there's oxygen, there's oral glucose, nitroglycerin, aspirin, that's the ASA, activated charcoal, epinephrine auto-injector, right? So you guys are supposed to be putting down the actions, the administration, contraindications, dosage, indications, and side effects, right? So I'll give an example of one, and you guys can do some, and we may just talk about some of the other ones. All right. So nitroglycerin is a good one to talk about because obviously it's going to be one that you'll need to be familiar with, as of course all of the rest of them are. But your drug interventions are limited right now as an EMT basic. Okay. But we're going to talk about this here, okay? So let's talk about the homework assignment a little bit, and then we'll get into some of the airway stuff and some of the other things I think we talked about in the announcements. So nitroglycerin, okay? Does anybody know what nitroglycerin is or what it does?
Isn't it associated with chest pain?
It is associated, the drug itself is supposed to be given for people with possible cardiac.
I'm sorry. What did you say?
Hold on one second. Somebody's saying they can't hear anything.
Okay.
That's who is that? I can't hear anything. That well, if you guys can hear and I can hear, then something going on with your system. Maybe let me send her a message back. Maybe something on with your listen because we can hear each other. Okay. All right, there we go. All right, so maybe she had to log off and log back on. She's logged up. Okay, so anyway, where was I? Nitroglycerin. So yes, it is associated with someone having chest pain, but chest pain doesn't always mean that that is something that's going to be related to the heart. Okay. So you got to keep that in mind. All right. Could be some other things that's going on. Maybe it's something muscle related. Maybe it's something pulmonary related. All right. Because your pulmonary system is obviously in your chest area as well. All right. But this, for the sake of time and some of the things that we're going to talk about, yes, it is usually associated with that. But what does the drug itself do? Do we know?
Does it help with breathing?
I'm sorry? What did you say?
I said, does it help with breathing
Um,
or get the heart back to regulating?
okay, so what? No, it doesn't. That's not the way it works. So what the way nitroglycerin works, okay, and you guys make a note of this here. All right. All right, nitroglycerin is used to prevent angina, which is chest pain, as Ms. Dow mentioned. Okay, it's caused by coronary artery disease or chest pain caused by or excuse me, coronary artery disease. It says this obviously it's also used to relieve an attack that is already occurring. Okay, now what else does it does? It says it works by relaxing the blood vessels. All right, so what does that mean? Relaxing by the blood vessels and increasing the supply of blood and oxygen in the heart. So in other words, normally there's a constriction there for blood to be able to be disseminated throughout the body. Well, what the nitroglycerin does is it relaxes those that constriction to allow an increasing supply of blood and oxygen to the heart. All right. This in turn decreases the workload. Does that make sense?
Yeah, so okay, so like it decreases the workload on our body, you said it releases and relaxes the blood vessels. And did you say increase or decrease blood to the heart?
It increases blood flow.
That's what I thought you said.
Mm-hmm.
Okay.
So
because it's doing the work for us.
Doing what work?
Instead of us depending on our body to do it naturally, this drug does it for us. That's what I'm saying.
Yeah. All right. So this drug is definitely assisting us with relaxing our blood vessels. Okay. So just imagine if you have some sort of clot, right? So let's imagine a vessel that somewhat have a small blockage, right? So what does that mean? That means that a lot of blood cannot get through that area, although some may be getting through there, right? But not enough. Does that make sense?
Yes.
Yeah.
Okay. So if there's not enough blood getting through that area, right? Because what did I say in class? I said that usually in an event when the not parasympathetic, but when the sympathetic system starts to activate, you get what's like a constriction of vessels, correct?
Yes. Okay. So you're saying that this makes it not constricted.
This relaxes the constriction. So it opens up, right? So if it opens up, then what is that telling you that's happening to the blood? It's allowing the blood to do what?
Increase the blood flow to the heart.
Increase the blood flow to the heart. And so if you're increasing blood flow to the heart, what are you doing also to the heart?
Increase the oxygen.
Exactly. You are also increasing the oxygen. You see what I'm saying? So if there's some sort of blockage or some sort of defect in that particular region, then this drug, nitroglycerin, will dilate, right? Increasing the blood flow to the heart, which in turn increases oxygen to the heart, which in turn decreases the workload. Does that make sense?
Yes, it does.
All right, good. So now, when it comes to your homework assignment, it says that you have to get the actions, the administration, contraindications, doses, indications, and side effects. So an example of that would be this right here. Nitroglycerin. Administration, it says, usually generic name is nitroglycerin. The trade name is nitrostat. Okay, nitrostat is the trade name. All right, so let's talk about the dosages. All right, dosages is 0.3 milligrams to 0.4 milligrams. All right, you guys need to know this here and or write this down. Okay, it's given in route. It says also in your homework assignments, it says, does it not have route in there? I guess they're considering administration as the route. All right, this is given by, you can give it sublingual with a spray, or they can give tablets. Okay, but the amount or the administration is by spray, sublingual. What is sublingual?
Through your nose.
No. Somebody look up sublingual and tell me what that is.
Apply under the tongue.
Good. There you go. Sublingual is
Oh,
under the
I
tongue.
think Santa said my mic don't work. Whoever name is Santa, I think it's Nate.
Okay. All right. It said,
Yeah, he answered it.
oh, under the tongue. Okay, I didn't see that there. Okay, my mic.
He's on the chat.
Okay, all right. Yeah, you need to get that mic. You need to get that mic working, brother. Anyway,
Okay.
uh, anyway, good job. Who is that? Is that Mr.
That's Mr. Henderson, I
Henderson
believe,
or
or Santa, Mr.
okay,
Yeah.
okay. So yeah, Mr. Henderson. Okay, good. Okay, so make sure you got that down or whatever. That's what sublingual is. All right, that's under the tongue. So usually you might have the person to lift their tongue and you may spray up under their tongue with that stuff. Okay. All right. So that's the administration. The contraindication. Let's talk about contraindications. All right. So it says one of the contraindications is going to be hypotension. All right, because what's happening now? Remember, I said that it releases constriction, correct? Don't y'all all answer at once now.
Yes.
Okay, all right. Let me know you're still here now. All right.
Oh, I get it. So it can make your blood pressure go up.
No, the drug itself cannot make your blood pressure. I said that your blood pressure would be already up in a situation in a traumatic event or whatever because the sympathetic nervous system has kicked in, right? So your blood pressure is already up. This drug, by it dilating the blood vessel, is going to lower your blood pressure.
Question. I'm sorry to cut you off. So is that
okay?
Okay, does
I'm
that make
sorry.
sense?
Is that gonna lead us back to the word you always use, homeostasis?
Say that
Yeah,
again.
sure. Is that gonna lead us back to homeostasis, the word you always use?
Not necessarily. Homeostasis, no. All right.
Oh,
It's going to
okay.
well, it's working, but in this particular situation, there's no guarantee it's going to do that. In other words, you're using the drug to help facilitate a current issue, which is the chest pain. Because the oxygen, if he is truly having a cardiac event, then this is to assist in to help relieve the chest pain.
Okay.
Okay. So there's no guarantee that homeostasis will take effect, although it may be trying to, but there's no guarantee that that's going to happen. Okay. So the contraindications of this drug, what is a contraindication?
Like the side effects?
Mm-mm.
The
What is
contradiction?
Say again?
what it's supposed to do?
No. So the
contradiction?
The contraindications is a reason why you don't want to give the drugs.
Oh,
So
like if they have this, okay.
It's not a side effect.
It's like the reasons why you don't want to give this, like this is the reason, like the people that you shouldn't give it to, you're saying.
Right. To a degree.
Okay.
It's not side effects, Ms. Davis, okay? That's not a side effect.
Like the people, it's the stuff that people got going on, so we don't need to give it to them.
Right. So I'm gonna give you an example. All right. So you got to be always asking your patients what? Sample, right? Do you have any allergies? Right? This would be an indication of why you wouldn't give the person the drug if he has an allergy to it. All right. Are you on any drugs like Viagra? Because we know as men, Viagra, or some of us may know, if you do any research or whatever, Viagra decreases blood pressure, right? It dilates blood vessels for blood to go down in the area of the penis, correct? For a male to continue to have an erection. Is that correct?
Right.
All right. So when you start asking the patient these questions like, do you have any allergies? Well, yeah or no. Do what medications are you on? Well, I'm not on any medication, but I do take Viagra. You see what I'm saying? Because if you give this drug and his blood pressure is already lowered because he has in his system Viagra, which lowers blood pressure, what is that going to do?
That's going to make his blood pressure go even lower.
Exactly.
So he would be a contradiction.
He would be,
because of the
this would be,
medication that he
he
already
would be a
takes.
contradiction. The drug would be a contraindication
I
to give
mean,
it
the
to him.
medicine.
Right.
That's what I meant. Yeah, that's what I'm
You know what I'm
looking for.
saying?
Contraindication. Yeah,
Right,
that's that word.
contraindication. Now, here's the thing. How would you know if his blood pressure is low enough to not give it to him?
You got to take his vitals before you give him any medicine.
Exactly. You need to take his blood pressure before you give it to him. So let's say, for instance, he is on Viagra, but his blood pressure is 160 over or 150 over 90. Then it probably wouldn't be a bad thing to give it to him. You see what I'm saying?
Right.
Because if it goes down, it's probably going to go down. It's probably going to go down.
It's probably going to help him.
Right. It's probably not going to go down so significant to where it's going to do any detriment. But if he's already at 90 or 80 over 60 or 70, you probably don't want to give it to him. You see what I'm saying?
Yeah, it makes sense.
Okay. Good. All right. So it's probably you want to give it to him. That's why you got to give and check his blood pressure. Also, if he's on, and then of course, if he's already, like you said, Ms. Dow, check his blood pressure, check his vital signs. You want to make sure that he already doesn't have, even if he's not on Viagra, you want to make sure that he doesn't have a low blood pressure already. Okay. Now, side effects, all right, would be the hypotension. Okay. Right. It's the effects of the drug. Okay, and what it's doing. All right. Now, therapeutic effects, it dilates arterioles and veins, and it decreases preload and afterload. So when we're talking about preload and afterload, what are we talking about?
Can you repeat the therapeutic one that you said? What did you call it? Therapeutic effect? Yeah. Can you repeat what you said?
Therapeutic effect is it dilates arterioles and veins. Okay.
Arterioles?
Yes.
Oh, that's the arteries?
Right.
And veins. So if it dilates, and then you said what was the question you asked?
I said this is the therapeutic effect.
Yeah.
And this is what it does. It dilates the arterioles or arteries and veins, and it decreases preload and afterload. Then I asked, what is preload and afterload? Or what
preload?
What are we talking about?
We talked about
preload and afterload.
We talked about this. I forgot. I think it's like something filling up.
What are we talking about filling up?
The lung?
No.
The heart.
Preload and afterload is dealing with the heart.
Okay, yeah. You was talking about the preload and the PV, like you were talking. Okay, I don't know. I'm kind of confused because we didn't really go over the heart that much, but you gave us like a brief little diagram about it.
Yeah, don't.
Yeah, I do remember you saying that, but I just don't remember exactly what it was.
Yeah, no, we talked about in general the flow of blood through the heart. We didn't talk about preload and afterload. What I gave you all was just the direction that the blood goes in through the heart, goes through the lungs, come back on the other side of the heart, and then gets disseminated throughout the body.
Okay.
All right. Now that we've discussed that before, if you can remember, I gave you 4 chambers, right, of the heart. If you can picture that and what we saw on the board. Right?
Yeah, you said the upper ventricle, something like that.
All right. So the right side, I said it was the right atrium, right?
Oh, atrium, yeah.
Right. So you have the vena cava, the superior vena cava, and the inferior vena cava. That side right there fills up the right atrium. This is considered preload. Okay. I didn't mention the preload. I just was trying to tell you the direction of the blood because I didn't want to give you all so much at one point, at one time. Does that make sense?
Yes.
All right. So that side is preload. The other side will be considered what? Come on, y'all.
Afterload. It has to be afterload. That one's
It has
preload.
to be, right? If one side is preload, the other side has to be afterload, right?
All right.
Right. Okay. So this is the therapeutic effect. Therapeutic effect, it dilates arterioles and veins and decrease preload and afterload. Okay. All right. Indications. I think you got indications on that sheet. What are the indications? Indications are what is the reason why you're giving the drug. Okay. Like ischemic chest pain. All right. Person has hypertension. All right. You're trying to lower their blood pressure. What is hypertension?
High blood pressure is high, hypertension. Hypo is low.
Exactly. Okay.
Pressure. Yeah.
All right. There you go, right there. That's your actions, administration, contraindications, dosage, indications, and side effects right there. All right. So you have to do that for each one of these drugs, which is not a lot. You got aspirin, you got activated charcoal epinephrine, and then you got oxygen and oral glucose. So let's talk about those just briefly. All right. I won't go into the action and administration of these particular drugs. That's your job to do that homework. But oxygen is also considered a drug, is it not?
Yeah, it is.
Okay. So you have to know that out of the oxygen that you are providing, you need to know that, what dosage you're giving through the particular device that you're giving it to. So how much oxygen can you give a person via a nasal cannula?
I think up to 6.
All right. So anywhere between
It was 4.
I think it's 2 to 6 milliliters.
Yeah,
right?
it's 2 to
4.
6.
So 4 is in that range, Santa. So yes, you can give it 4. Okay.
Okay.
But you can't go no higher than that because you will dry out their nares. You'll dry out their nasal passage. Okay. Now, for a non-rebreather and a BVM, for a BVM, you can give 15 liters of oxygen or 15 liters of oxygen, 12 to 15 liters, okay, of oxygen. Okay, this is going to give them more oxygen, obviously, as they may, it may be possible that they may need it. Okay. And then you got your non-rebreather, and you can give up to 12 to 15 liters of oxygen in that as well. Okay, they can breathe that in. What's the difference between the non-rebreather and the BVM?
The bag valve mask, isn't that the one where the person is like breathing on their own? I don't know. I just know that the non-rebreather is connected to machine.
No. I mean, if you want to consider, what machine are you talking about?
Okay, not a machine. It's connected to the oxygen. I keep saying machine.
All right.
I always say that, but it's connected to the oxygen. But the bag valve mask is just like a bag.
They're both connected or should be connected to the oxygen.
Oh, okay. Well, I didn't know that. I just thought that because I thought that on the scene when we used the I guess that's not called that. When we did CPR, never mind.
Yeah.
And we had that we had a manual one. Is that not the BVM manual, or is that a non-breathing?
That is the BVM, but that also should be hooked up to 15 liters, 12 to 15 liters of oxygen. You didn't do it in class because we were just trying to show you what needs to be done when breathing or mechanically breathing for your patient.
The difference between the two, I just know they look different, but I don't know technically what I don't know the answer.
Does anybody know what the difference is between the two? I just kind of gave you or just kind of said it, really.
Yeah, like one's harder to breathe through than the other one.
No. Ms. Davis, you want to give it a shot?
I ain't gonna lie to you, counsel. I don't even know.
All right. So one, you can put it on a patient who is breathing already, right? Usually the other one is put over the person's face because they cannot control their own airway and you need to breathe for them.
Yeah, you did say that. You did say that. But so it's the non-rebreather is the one that we use with the foreign gel,
No,
the oral foreign gel, or is it the bag valve mask?
it's the bag valve mask you may need to use. Now you may not need to use it if you're bagging them in there and they're getting good chest rise and anything. But if they're not, then you may want to use the oral pharyngeal.
Yes, and that's the one that when they're unconscious we can use the BVM, right?
Exactly.
Okay, so that's the difference.
Right. So you can see that if a person is conscious, they can breathe on their own. They just need some extra additional oxygen. Then you can put that the non-rebreather on them and the nasal cannula. But if they are unconscious and they can't control their own airway, then you need to bag mask them. This is called mechanical ventilation. Okay? Does that make sense?
Yes.
Yeah, it
Okay.
makes
So
sense.
the process is called mechanical ventilation that you just described when only when they're unconscious or just both?
No, you use
Whenever
the
you,
bag mask when they're unconscious.
and that's called mechanical
Mechanical ventilation. You're assisting,
ventilation.
you're breathing for them.
Okay, that's what that's called. Breathing for them, mechanical ventilation.
Question.
Okay.
So do they use that in the ICU?
It's possible they may use that in the ICU.
Okay.
Usually, but by the time they get in the ICU, they are using machines that they can put them on.
Okay.
So, because this is going to be a continuation, usually the bag valve mask is usually used most of the times when we are in pre-hospital. Not saying that they won't use a bag valve mask in the hospital, but usually that's if the person is gone unconscious and they go into cardiac arrest or something, they may use it in that manner or whatever can be. But other than that, if they're stable in their ICU, they may just have them on a machine or something other. Because nobody's going to be standing there 12 hours a day, changing shifts, bagging the person for those long hours. You see what I'm saying?
Yes, sir.
All right.
Yeah, it makes sense that the bag valve mask is what you use when they're unconscious because that's what we use for CPR, and most time people be unconscious.
Exactly.
It's like easy to remember that.
Okay. Right. So you guys should have a good handle on your homework assignment. And this needs to be done before Monday, from what Walter said. All right. So don't y'all come in there without that homework. All right. So now, talking about those drugs, you got to have some reasons on why you need to give it. It needs to be the right patient, right dosage, right route. Okay. What else? Let's see, right patient, right dosage, right route, right time. And I think there's another one. All right. So you can't give this to a patient who's has to be the right patient, obviously. It can't be allergic to it and all those type of things we mentioned previously. Let me make sure. Let me see how much time we got left because we may have to start another one in a minute. All right, we got 5 minutes left, and then we'll start another one if we need to, which I'm sure we are. All right. So yes, so right patient, right route, right dosage, right time. And there's another one. I think there's 5 of them. All right. So we got to make sure that those things are right. Okay. Got to be the right dosage. You don't want to overdose someone. Okay. Right patient. Now, again, you don't want to give, Ms. Davis something that, Ms. Dow is supposed to be taking, people in the urban communities and sometimes probably in the other communities as well, Folks like, man, I got such and such and such. Oh man, I got a drug for that. You need that? You need some of that? And your families will give you that drug or whatever the case may be, right? You ever heard people do that before?
Yeah.
Yeah,
Yeah.
that's right.
Yeah, I mean, yeah, that happens all the time,
Right.
especially in A Walking Dead.
Okay, so what?
The show Walking Dead, like, I mean, like,
Oh,
you know, if it was apocalypse, we're gonna have to use other people's medications, but legally, we're not supposed to do that
why not though?
because that's not. It's just not your medication. It could be expired. There's a lot of things you're not supposed to do. But so a lot of people don't have insurance. So realistically, if you have something, you know, you could just sell it on the street or something, you know, but it's still not good. It's
But
just a lot of
why?
people don't have insurance, unfortunately.
But why should you not be taking someone else's drug?
Because it wasn't prescribed to you.
And why should you
You
take
don't
the
know
drug?
like what effect it can have on you versus them.
Exactly. The drug was
Yes.
not prescribed for you, so you don't know what type of effect that it's going to have on you. Every drug that we take doesn't mean that it will work the same for you as it did for, the other person. That's one of the main reasons you don't take other people's drug. So when families like, oh girl, I got so and so for that. You see what I'm saying? So you don't want to be taking the other people's prescription for that main reason. Well, those are one of the main reasons, okay? Right time, okay? All right, don't be taking drugs. Example, I guess, would be don't be taking drugs, if you hadn't eaten yet, right? If you hadn't eaten yet, don't take certain drugs, whatever. Most of your drugs that you take that are prescribed to you, they want you to be done ate something. You see what I'm saying? Take this in the morning, take this in the afternoon, take this late at night, right? Because if you take it the wrong time and it's have you drowsy or whatever the case may be, it wouldn't behoove you to take that drug during the beginning of the day. Okay. Right route. All right. Is this supposed to be given orally? Is it supposed to be given rectally? Is it supposed to be given through the vascular system? You see what I'm saying? You need to know that. Okay. So you got to know those particular things I just mentioned. And what did I say they were? Right, what? Are y'all writing this stuff down?
Yes, but I didn't hear you said they were right. I didn't hear that part. You
What
said
is
right,
what do you have to what are the reasons or the 4 reasons I just advised that you have to give the patient? You did so if you didn't write it down, then what are you giving them for? Right what?
treatment.
Right no, right patient.
You were saying make sure you give the person the right dosage and the right person.
And what else? Right patient. All right, don't let Miss Dow be the only one answering the question.
Care report.
Huh?
Patient care report.
No, not patient care report. Right patient, right dose, right route, right time.
Yes, for the prescription.
Has nothing to do with patient care report.
You're saying make sure that you take everything on the right time. Make sure you eat. I'm saying I don't understand the question you were asking.
The question was, why are you giving? It was just a reiteration of what we just covered. Why are we giving the patient, or what is the rights? What are the 4 rights?
Oh, okay. I thought it was just like the patient care plan. Okay.
Right time, right dosage, right name, right right patient, right location,
And right route.
right route.